Good afternoon. Thank you, Darlene. So I just want to emphasize a few things that Darlene talked about. Number one is that really from a personal standpoint, the best things that people can do is to take care of themselves, and that is just what Darlene said, washing hands, covering your cough or sneeze, and continue to do social distancing. That's what's going to really help to stop the spread of this, okay? The reality is, again, as Darlene said, we have 0 cases within any of our facilities. We do know that there's 1 documented case within Oneida County, and the Oneida County Health Department is monitoring that person, as is their duty, and they are keeping us apprised of where that person is and what we may need to do should they get sick. That being said, we are also looking at patients within our facilities who are ill and who have influenza-like symptoms and are testing them appropriately. So far, none of those tests have come back positive. We are doing appropriate isolation for those patients to make sure that should they come back positive, that we have not been exposing people that would otherwise need to be quarantined. We are following the guidelines both from the World Health Organization, the Centers for Disease Control, and the Department of Health in terms of what is required for caring for patients, for preparing, and for making sure that people are as safe as possible. And that includes such things as what do we do when we have a healthcare provider who is themselves potentially exposed, and should they continue to work or not, and under what circumstances should they? So those are all fairly well delineated through the Department of Health and the CDC, and we really appreciate what their guidance says. It is important for everybody that everybody know that we are following what is best knowledge and best practice at this time, and that if everybody does that from a community standpoint and from a health standpoint, from a health care standpoint, that we will get through this. This is, as I've said, this is a marathon, it's not a sprint. And we will be able to get through to the other side, and we will be able to, as Darlene said, to get our lives back. So with that, questions either for Darlene or for me, I'll be glad to take whatever, and I think Darlene will too.